We're gonna move right along to our next speaker, and then we're gonna have a brief Q&A after everyone is gone. Our next speaker is Andre Mays. He is a staff organizer for the Sheet Metal Workers Local 71 in Buffalo. Andre, take it away.
Thank you all for your time. I appreciate it very much. It's good to see so many fellow DSA members on here that are fervent and ready to get out there and take care of this. So I'll do a quick, brief background. My name is Andre. I'm an organizer up in Buffalo. I started working at a company called Danforth as a non-union truck driver. They do have plumbers union and a sheet metal union there. And when I learned about the benefits and wages, I decided that's what I was going to do. So after about 2.5 years, I got into the union, and I can very adamantly say that being in the union has increased my standard of living and my quality of life very much. I mean, there's anyone who lives upstate and downstate, but there is, up in Western New York and the Finger Lakes and Central New York, there's a stigma from about 70 or 80 years of people fleeing the cities up here, and life can be very difficult. And being in a union has been an excellent way to carve out a middle class living for me. So that's just a little background so you know where I'm coming from, because I kind of want to speak from a union perspective, at least anecdotally. But back in early 2020, our union's healthcare was in crisis. At the time, we had negotiated to have our contractors pay $7.20 per hour for our healthcare, which, doing a little back of the envelope math, comes out to $57.60 per 8-hour workday per member for healthcare coverage. In 2020, this still wasn't enough to cover the ballooning costs of our private coverage. So we had to open our contract back up and have a big meeting on how we were going to cover our healthcare. The contractors weren't willing to chip in any more money, so we had to take $2 per hour out of our annuity and place that into healthcare just to keep it solvent, which pushed for an 8-hour day of work the cost of coverage to $73.60. So for comparison, the average Dane, someone from Denmark, pays about $50 per month in taxes for healthcare, just an average middle class wage. So $50 per month versus $73.60 per day. And that, we consider ourselves to be very, very lucky with our healthcare up here for that we get from the union. So that's money that we would like to use annually for raises or to go towards our annuity instead of coming out of it, or into our pensions, which, not to even to get into that, is something else that's vanishing rapidly. But all that money is getting swallowed up by healthcare cost. So when I'm speaking to union members, the question that I ask myself is, how would the New York Health Act help unions? And by creating a single payer healthcare system in New York, my union's members would have an extra $9.20 to do with as we pleased. That's money that we bargained for as a union that we would expect to be able to keep the majority of. And even if our contractors did claw some of it back, even saying half of it, that would leave us about $4.60, if my math is right, to place into pensions, place into our annuity, place into our paychecks. And we would no longer need to negotiate over the basic human right of healthcare. My fellow officers and I would be able to spend our negotiating clout and energy on further improving the lives of our members' standard of living elsewhere. Like I said, in pensions and annuities and paychecks, or maybe even to have a little bit of that money would be nice to use to get to have a little bit of sway in lobbying efforts elsewhere. I mean, I work closely with local governments here to try to get pro-union legislation passed, and this is just anything that we have to negotiate over or go to government for. It's just another piece. It's time spent and energy spent that could be spent elsewhere. And I think that healthcare is a pretty bad place to have to be spending energy. It's a basic human right. A major grievance that union members have is that if they are young and single, they have they don't want to pay for the healthcare of older, sicker members, or for members who have families. The New York Health Act would create an even playing field where healthcare becomes both cheaper and easier to access, and eliminates the complaints and a lot of avoidance that people seek, because when it's free at the point of service, you just go if you have a problem. You don't think about, well, I have to schedule an appointment, I have to get a referral, I have to cover the co-pays, what are the deductibles, what are, all that other stuff that you would no longer have to worry about. I also, the Health Act would fix a few major problems that were created on the Affordable Care Act exchange market. By creating the mandate for young people to purchase private insurance, companies were able to maintain high prices as it is now, as it was law, for people to have coverage. It wound up being that a lot of young people took the annual penalty instead of getting health care. And as that forces older and sicker patients to shoulder the burden of the cost, it has an upward pressure on prices, because this is, the Affordable Care Act was not a price. It wasn't a healthcare coverage fix. It was an insurance fix. Everybody now must be insured, but it did not put any realistic downward pressure on prices. And then, as we all saw in the last few years, the GOP-led repeal of the individual mandate and opening of states to have open markets across state borders has led to more healthy people dropping off insurance rolls and employers being able to purchase skeleton plans from other states and sell those as insurance, which has a simultaneous effect of raising prices and lowering quality of care and coverage. And the only reason that my union has been able to maintain the private coverage we have is because of the size of our purchasing unit. We can collectively bargain for reasonably cost to get the money from contractors, and then as a large unit, we get a better deal on healthcare. We have zero premium plans with no deductibles and low co-pays due to our bargaining strength. The New York Health Act would do the same for New York on a grand scale. My 600 union members would join 19 million other New Yorkers on a single government-provided plan that would dramatically increase the leverage of every citizen in the state when bargaining for affordable, quality health care. So, in conclusion, it's often said that healthcare is the single greatest recruitment tool for unions, but I find this view to be cynical and short-sighted. My union and our state and nation would benefit far more from being able to put that money into wages, retirement, or even, as I said before, effective political organizing for my union. Our people, be they, from New Yorkers or Buffalonians or from Rochester, Syracuse, Utica, Watertown, all over the state, would do far better as a whole if healthcare was something you simply expected to be there, like the fire department when your house is ablaze, or the roads that we all use to get to work. We have a long way to go as a country to catch up to the rest of the world, but I do believe that this is the first generation in a century that's no longer blindly accepting that we must do more with less to defeat, the terrifying scourge of worker power and solidarity. I do believe with all my heart that, my union, that both unions, the one that gave me my trade and the one that pulls our country together, would be better off if we treated healthcare as a public good and not a profit center. And with New York being the financial hub of the nation, we would be the best state to lead by example. And with the votes in both chambers of the state legislature, this really is the best time. On top of that, with COVID, all these factors coming together, this is the best time to push forward and gain the same quality of healthcare for all New Yorkers that my members get to enjoy and that the rest of the world gets to enjoy, and for a fraction of the cost. And that's why I believe that time is now for the New York Health Act. Thank you.